artificial nails. Communication. As part of leadership, one has to know about communications. You have to know how to speak to the recipient of the message. Many times you think you're giving a great message. You can do it in, you give talks, you give memos, you send out daily reminders. But if you're not speaking in the language of the recipient, it isn't going to be effective. If the recipient doesn't trust you, it also is quite difficult. For most of you in the management side, you have to realize there are differences in how management thinks versus how clinicians think. Administrators or management, for those of you, are much more proactive planners. You're thinking down the line proactively. You learn to work well with groups. You are much more interested, you're willing to have delayed gratification because of a plan. You identify much more with your organization. You don't mind rules. Rules you think, we tend to believe helps us be organized, and we work multidisciplinary, in multidisciplinary ways. As opposed to that, clinicians, especially physicians, tend to be reactive. They see a symptom, they react to it. They see a problem, they want to fix it. They work well one-to-one. Part of the problem with the older education in medicine is physicians were taught to be autonomous, in charge. Hopefully what we're seeing now in medicine is much more teamwork. For high reliability organizations, we realize that it's teams that make great organizations. Physicians tend to want quick gratification. I put that as an asterisk because this is the same group of people that waited till they're 32 to 35 years of age before they were done training. So they've spent their whole first third of their life delaying gratification. After that point, they say, I want it and want it now. Clinicians tend to identify with their profession much more than the organization. So I'm a doctor, I'm an advanced practice nurse, I'm a sub-specialist. They resent rules and they think in their silos. So if you're going to be successful, you've got to be reminded that they're coming with a different frame of reference, different mental model. And it has to be talked about because you get frustrated working. If one side works with the other, they get frustrated because they look at the world differently. And Dr. Bujak also once had a great quote and a way to think about it. You talk about patient apostrophe S advocate versus patients S apostrophe advocate. The physician and clinicians tend to say, I am that individual's patient advocate, and I will do everything in my power just for that patient. Whereas administration, management, most of us in this meeting tend to think of ourselves taking care of a large population. And we're always fighting that battle, that ethical dilemma. It's not right, it's not wrong, it's what the reality we're in. And so again, when you interact with staff, at least physicians and advanced practice nurses, you have to remember that. You're thinking population health, they're thinking individual health. One of the things we began to do is not accepting excuses. We took the quotes from Florence Nightingale, I attribute my success to this. I never gave or took any excuse. When you hear people who walk into a patient room without washing their hands or without foaming in or foaming out, you hear that line, I was just going to get something, I wasn't going to touch the patient, I wasn't going to do anything else, I was just going to. We don't accept that as an excuse anymore. Because what we began showing, and this came from an article in Critical Care Medicine in 2010, this nice little diagram where you show every one of those spots is where the pathogens are sitting. So you might think, well, I didn't touch the patient, but I touched the IV, I touched the computer, I touched the sinks, I walked in the room, and we reminded people, these pathogens are everywhere, even though you don't think you're touching the patient. Next time you go in a room with a group, we do family-centered rounds, so we have large teams coming into patient rooms. You watch the people in the room. Don't say anything. Somebody's going to lean on the sink. Somebody's going to be touching the computer keyboard or looking at the monitor. thinking that they haven't touched the patient so they won't get infected or they won't transmit an infection. We call this the concentric circles of transmission. We take the World Health Organization's 5 moments of hand hygiene, we adapted it, the 3 before and afters. Before entering and after leaving the patient's room, we need to foam in and foam out. Before crossing the threshold, as you exit, you are not, we tell ours, you're not required to double clean if you're going directly from one, you're foaming out and going into the next room if you don't touch anything. But before and after touching the patient, because we're in pediatrics, there's a lot of diaper changes, tubing changes, and before any and after all procedures. We also created thresholds, red lines, to remind people that they cross that threshold, they have to foam in and foam out before crossing that threshold. So we move the line so that it reminds them, but again, a strong thing that we focused in on. We reminded them, as I said earlier, the bad guys are cancer, the bad guys are disease, the bad guys are HAIs. We're working together, and as you know, that not our competitors, not everybody in the organization. We're in this together to fight the bad guys, whether it's bacteria, fungi, viruses, or parasites. But we also know there'll always be barriers. It doesn't matter what change you want to do, there are barriers. And remind yourself, those who stand to lose from policy changes always battle harder than those who stand to gain. An asymmetry that is exaggerated when losses would be concentrated and gains are diffuse. So whether it's in healthcare, whether it's in the government, think about what goes on in policies and politics, whether our debates about healthcare reform, whether it's gun control, whether it's anything, and I'm not right or wrong, the people who are most likely to lose something, they will fight something much stronger than those who may have some gains. And this is true when we're trying to change our culture with HAIs. Some of us believe that people don't change when they see the light. They change when they feel the heat. I'm a big believer, and Children's is not a big believer of using, in a sense, a metaphorical stick. We'd rather use carrots, but just educating alone and seeing the light doesn't do it. And we know that. We've been having this issue for 150 years. We also believe transparency is key to patient safety. We have been using unit-specific rates, and they're shared house-wide, how my unit is doing to the other units in health hygiene, and HAIs and hand washing. Rates by role by unit will be shared, so we know how doctors are doing, nurses are doing, therapists are doing. Oh, but we haven't gotten to the point where we can in other areas of change where we can give people individual data. That's when we know real change will occur. When we can say to an individual, you know, you were observed secretly, you know, in secret. I'll just go back. Excuse me. You were observed secretly, and we've noticed that you only wash your hands 60% of the time. When we can get to the point of giving individuals data, that's when we believe we'll get to the next level. Children shares our data in the system, and we acknowledge our pledge to our websites acknowledge our pledge to the patients. Leadership is always under pressure, so if you're in charge and you're going to be the ones trying to change your culture, you will always be watched, how you react under pressure, how you act positively or negatively. So in April of this year, actually by May 1st, we created a cultural change that we've all signed up for. And it's important, not that it gets you a huge leap, but it's important when you get people to commit to something that they actually sign their name. They sign a document, and they put their name to the commitment. We started our cultural change with the words "wash 'em proud," and we began with all our directors, whether medical directors, managers, supervisors, and slowly took it out to the whole organization. We made sure we worked with our marketing department. We had a campaign with a signage throughout the organization. Whether you're coming to the floors, the elevators, you would see stop, foam up, wash them proud, making sure people said thank you for washing your hands, having cute little posters, you know, especially in a children's hospital. The cute poster that says, do you know where those hands have been? Those kinds of things going on. Be open and proud about keeping your hands clean. Remind those who don't. Talk to families about why we're also committed. And we also have on our dashboards, Children's has been using lean management methodologies for 5 or 6 years. We have a daily huddle with all our managers, directors, executives, including the CEO a lot of the times at 9:30 every morning. And every day part of that dashboard is when was the last time we had a HAI in the organization, when was the last time we had a significant serious event. And you know, we're up to, we get up to 45, 50 days. We're very happy. We want to have it a whole year like we do with our CLAPSIs. We've gone 900 days at one time without a CLAPSI in one of our ICUs. I'd love to say the same thing about HAIs.
Dr. Keyboard, you had asked an interesting question earlier in the webinar, so we put together a quick polling question. So if you don't mind, I'll interject and run that now.
Good, okay.
And the polling question is, do families in your institution feel comfortable reminding staff to wash their hands? Is that something that your facility encourages families to do? And if you do that, are they comfortable doing that? Yes, no, or you're not sure. So we've got 40% voted, and I apologize, I forgot to show the results of the last poll, but I will definitely do that this time. So we're at 55%. We'll give people a few more minutes to vote. And just about another 15 seconds here. Okay, I'm going to close the poll and share the results. And here they are. So let's see, 15% said yes, they are comfortable, 28% said no, and 56% not sure. Does that say anything to you, Dr. Keyboard, that maybe they're not talking to families about?
Yeah, I think for the 56%, it's time to ask.
Yeah.
It's time to find out.
Sure.
I think, you know, one of our philosophies is that Children's is very patient-centered and family-focused, and we believe we are guests in their lives. Even though they're coming into our organization, we're guests in their lives, and they're our partners. And we need to partner with them. We need to ask them what they're comfortable with and help us and to help themselves. And so we need to ask. All of us need to ask.
Great. Okay, I'll hide this poll and let you go ahead.
Okay, thank you. So what we had asked people to sign up to is, I hereby commit to cleanse my hands before entering and after exiting a patient's room, before and after touching, before and after procedure. Advocates for the safety of every child. Again, as I said earlier, we're 200% accountable. Speak up to remind those who forget to cleanse their hands, say thank you, and talk openly about why hand hygiene is so important. So I'll ask each one of you, and you'll have to answer it for yourselves here. Where are you on the leadership accountability ladder? We'll start from the bottom. Are you, are you a powerless leader? Are you unaware and unconscious? That's what my wife tells me for most issues at home. I'm unaware and unconscious. Do you have a tendency to blame others? Or do you tend to say, I can't do something? Are you one of those that wait and hope? And some of you have heard the expression, hope is not a strategy. Or do you start moving up that powerful leader ladder? Do you acknowledge the reality you're in? Do you own it? Do you begin to find solutions for your organization? And then do you get on with it? Whether you're completely successful or not, but do you get on with it? So I'm going to give you a formula that I believe is probably the most important formula as an assessment of your leadership skills. And the formula is T equals C plus R plus A over SI. Now, what is this T? The T is trust. For you to be a great leader and to be able to get your organization to move, you have to be trusted. I think this is more important in leadership than any other attribute or skill. And when you trust, how do you make an assessment if you trust somebody? And I actually believe this works whether you're talking of coworkers, if you're talking about family, or even if you're talking about people you assess in the public. Again, whether in government, politicians, teachers, it doesn't matter. What is it that how do you make an assessment of trust? So what did the C stand for? Credibility. Are you credible? Do you have knowledge in your field? You don't have to be a Nobel Prize winner, but are you credible in the field you're in? And people, they'll say to themselves, if you're credible, they'll begin to trust you. If you don't have credibility, the chances of trust go down. Are you reliable? Do you do what you say you're going to do to the best of your ability? You know, if you tend to promise one thing and don't come through, people's willingness to trust you goes down. It's a very important attribute. And third, authenticity. Are you authentic? You can't fake who you are for very long. People will figure it out. And authenticity, people do need to know a little bit about you. What are your values? What's your family like? What are your goals? They want to know you a little bit for them to trust you. And you take all of those attributes in the numerator and put them over the denominator of SI, self-interest. Trust goes down when, as a leader, you seem more interested in your own self-interest, or your own self, than others. Great leaders are interested in what's best for their organization, and they put their own self-interest second. I tell you, if you use this, if you think about this will work in almost any facet of life, that when you think about somebody you trust and then somebody you don't trust, think about this equation. This will have impact on how we work at Children's and who we choose to be our leaders in the organization. So in summary, what I've tried to convey a little bit today was this is going to be a journey. It's a journey for us. I would tell you our hand hygiene numbers are still not much better. Now we're 6 months to 9 months later, but our HAIs must have some impact because we're down greater than 10 to 15% ahead of better than planned. We are very much aware of not only HAIs but CLABSIs, C. difficile, and we've been fortunate. We're participating with a group of 83 other children's hospitals in sharing our data under safety to see that we're saying to each other, we're not going to make that a competitive aspect of us. We will gather our data together and look to find the organizations that are doing the best job. This is a journey. It's a long one, but hopefully we will get there. It is long and difficult, but as a great Chinese philosopher over 2,000 years ago said, a journey of 1,000 miles begins with a single step, so let's take it.
And Dr. Kibor, if I could just insert the last poll of this webinar.
Okay.
And that poll is, I'll launch it now. Would you be interested in future Learning Connection webinars which focus on leadership and change management? Dr. Kibor did a great job of touching on those topics today, but we could even go more in depth if our audience is interested. And we'll give people a few moments here to vote, and then I will share the results. So are you getting enough of that now in your place of work, or would you like us to augment it possibly with a webinar? I will go ahead and close the poll. It looks like we have about 65% voted, and share the results. And the results are, wow, an astounding 98% said yes, and only 2% said no. So it sounds like there's a need for, with a little help in leadership and change management. I think we can all benefit from those principles and learnings, but this audience especially seems to need more. So I'll go ahead and hide the poll, and you can finish up.
All right, well, thank you. I'm a little worried about that 2%.
Yeah.
But that's okay. So in conclusion then, as we said, our launch day to zero HAIs began May 1st, 2012, and I hope hopefully by the end of 2013, our goal is to decrease by 40% and keep moving down towards zero. And I hope we'll get there.
Wonderful.
And I think I want to thank all of you. I'm very willing, if any of you would like to contact me, here's my email address at childrensminnesota.org. And I always like using my last quote. You know, finally, those are my principles. If you don't like them, I have others. That's by Groucho Marx. But I had extra slides, and I'm not going to show them, but for those of you who are interested in change management, there's a great book called Influencers, and I think I listed, we didn't put them here, but Influencers, it's by the Covey, same people who work with Covey Group, about changing organizations based on six major areas. So I'd highly recommend that book for you if you're interested. But I'm happy if any of you want to email me to talk, to send your slides, I'm happy to do that. So again, thank you very much, and I'm happy to answer any other questions.
Great, wonderful. Thank you for just a fantastic presentation. We do have a few questions that have come in. Before we get started with those, I want to give a few audience reminders. The first thing is that the PDF of the slides for this presentation were included in the reminder emails for this webinar, and will be also included in the thank you follow-up email. So you will have a PDF of this presentation if you want to refer to that. Another thing that I wanted to let you know is, again, if you're watching this webinar with a group of people, you can forward the thank you to other folks so that they can fill out a course evaluation and get their CE credits. So with that, I encourage you, if you haven't, to submit your questions, and we'll get to as many as we can. We'll go right up to 2 o'clock. So first question is, our institution is trying to implement surgical timeouts. How do we get surgeon buy-in for the surgical timeouts?
Well, I think, again, it depends on the type of organization, whether it's an employed model, a faculty model, or, you know, private practice. But we went through this a couple years ago. Like most things, you do need to find a leader, a champion. And it always helps to have a champion that isn't top-down in the sense that it can't, while you need the support of a CEO, a CMO, what you need is a surgeon who understands why this is important to be the champion in moving this ahead. You know, most of the literature now, whether it's the World Health Organization, whether it's national studies, have shown how timeouts have actually worked beautifully in decreasing the numbers of wrong-sided surgeries. They still occur, but it's much better than before. So, you know, my reaction is you need to find a champion who understands this, understands the literature, and says, I will take this on. And, you know, there's been studies to show that to change a culture, you only need, let's say you have 100 surgeons on your staff, you actually only have to change the square root of whatever number there is. So out of 100, you'd only have to change 10 of them. And if you can get 10 of these key people to change, you will change that culture. So there's plenty of organizations have done it. We've been fortunate in the state of Minnesota. All the hospitals in the Minnesota Hospital Association agreed to it, to do it all at the same time. And so surgeons couldn't threaten to say, well, I'm going to go to a different hospital because I don't like this policy. So that was actually very helpful in the state of Minnesota.
Ah, good to know. Okay, next question. In places where families are asked to keep an eye on caregivers washing their hands pre- and post-care, how do these facilities go about asking the families to do this?
We do it when we talk to families first before they said they didn't want to police. We do tell people when they get admitted or when they come into our facilities to, one, to teach them about foaming in and foaming out, and to make sure others who are touching their child are also doing it. So, and for those of, about 30% of our patients are, I apologize for the statement, are frequent flyers. 30% of the kids come back. And we send out surveys after they have left, we use Picker as our survey company, and on it we ask, did your care providers, did the clinicians foam in and foam out? And so, their families become aware that they should be observing for this. So we do get some information from families after they have left, but we believe when they come into our institution, they should be told right away. If you walk into Children's today, you will come, regardless of the entrance, there will be somebody at the welcome desk or a welcome spot who will ask who you are. They will put a stick. You'll get a sticker, and you'll find out if you've had cold symptoms, and they will talk to you about foaming in and foaming out. So we try to do it at all entry ports and exit ports.
Great. Someone chatted in that they would like to see your email address again, but what we'll do is just chat Dr. Keyboard's email address to all attendees. Actually, that should be out to you now, so hopefully everyone has that who wants to reference it. We didn't have it up on the screen for very long. Okay, next question. Did you put together a team for your HAI reduction effort, and who was on the team and how were they chosen?
Very good question. The answer is yes. We use, I am blessed to have an unbelievable strong infection prevention and infection control department, a great epidemiologist. That's the one part of leadership I should have talked about, is that they get good people, because they know much more than I do. So I had a strong infection prevention and control group. They were on it. Then I had our marketing communications department as part of it. We had we have 3 major directors, nursing directors in pediatrics, critical care, surgery, as well as the 3 chiefs of those divisions, and they became our team. And they began to spread out the word when we began having a focus in on this. At Children's, on all our committees, we also have family members who participate on all our committees to make sure that we're getting a family's perspective on what to do. And so those were the main people on the task force.
And how did you get the families, Dr. Keyboard, for those panels?
Well, we do have, as I said, we have a family advisory council. I think there are about 30 people on it who they have to apply for it, and we don't control it. They control it. They have 2-year terms that they can re-up for up to a total of 6 years, and we try to change it over a third of it every year or so. And somebody on that council will volunteer, or they will help go out and find somebody who's willing to do it. So we never have trouble. We have never had trouble finding parents or families who want to help us be on our committees, whether it's for designing new facilities or things like this.
And this is sort of a related question. Did you, or how would you get buy-in from the CEO for these types of programs?
Well, a couple comments. I'm fortunate that our CEO happens to be a pediatrician by training, so it's not hard to clinically convince him of it. And but I'm also of the belief that you don't have to be a clinician to be the CEO. Most CEOs out there, unless they've been, excuse the expression, unless they've been hiding under a rock, they're aware that this is one of the big issues in all hospitals, that HAIs are a huge burden to each individual hospital and to the public and to the healthcare system in itself. So you would hope that they have enough insight to say, we've got to do something about it, especially when data is going to be transparent, and secondly, when the payers are going to say, we're not paying for that anymore. People, when the CEOs know that the payments are going to stop when a patient gets an HAI, that will catch their attention.
Yeah, I'll bet. Okay, this is an interesting question from an international attendee. It says, are you aware of WHO annual Clean Hands campaign each May 5th? We've been a partner since 2009, but not sure of the U.S. involvement. I see more responses from other countries than from the U.S.
Yeah, to be honest, I was not aware of that. I am aware of, when I give this talk, it's a longer talk, we do talk about the WHO methodologies of how they do hand hygiene. They have, they've done a stronger job than actually what we've done in the U.S. So I am aware of of what they're doing, but I wasn't aware of the May 5th aspect.
Okay. So with that, that basically sums up all the questions, although several people chatted in. Great job, enjoyed this one. So kudos to you, Dr. Keyboard, for a really wonderful presentation. And thank you to our webinar attendees. We are very pleased that we know how busy you all are. It's very hard to take time out for learning sometimes, and we so appreciate your time and your effort in attending today. And if you're interested in other Learning Connection presentations, please go to, it's on the screen now, 3m.com/IP education, both for live webinars. And in about a week, this webinar will also be archived for self-study. Just look for the self-study link on our website. So again, thank you, Dr. Keyboard, and thank you to all the attendees for a really great event.
Thank you, everyone. I really appreciate it.
Thanks, everyone. Have a great day.